So I'm Katelyn Williams. I work here and live here in Dallas, and I started having sinus issues in October of last year is when I first noticed it. I was just having sinus infection after sinus infection. So I had about 4 within 4 months. And I realized that's kind of a problem. With those sinus infections time after time after time, I was having very severe headaches to the point where those last 2 months, month 3 and 4 of sinus infections, I was having migraines that would cause me to vomit because it was just so severe. And that was really confusing to me because I honestly didn't know that sinus infections could go to that level of causing migraines and causing vomiting. So I went to just my primary care physician, and every month they were like, yes, this is a sinus infection, here's more antibiotics, it'll clear up. And after the 4th round of antibiotics, I said, this is not clearing up. So my primary care physician recommended me to Dr. Wyatt. He evaluated me. He stuck a lot of things up my nose, but that was for his benefit so that he could really see what I was experiencing, see what the problem was, and immediately he knew that these chronic sinus infections weren't going to get better on their own, that I needed to have the sinuplasty procedure. It's been about 6 months since my procedure and I haven't had any issues, haven't had a single sinus infection, which is just great. Right after the surgery, when I got back to work, I would sneeze in the morning, and that I realized that was just because my nasal passages had been opened for the first time in years, that I was smelling things and experiencing things that I had not before. I never had to wait on Dr. Wyatt, so I would get into the office and I'd see the nurse and then I'd see Dr. Wyatt. So I really appreciate that he keeps to his schedule as far as I'm aware, because it seems to me like he really values my time and knows that I'm busy as well.